Millions of people benefit from vaccines that protect them from dangerous infectious diseases. As a healthcare provider, your patients trust that you will administer vaccines that are safe and viable. It is essential that immunization providers fully understand and adhere to the most current practices for properly storing and handling vaccines in your office or clinic. You must protect your vaccine supply. In reality, we don't lock our vaccines in a safe, but you still need to safeguard your vaccine supply. Today, we're going to talk about proper vaccine storage and handling. If you want your patients to be protected by the vaccines you give them, then it's your responsibility to handle vaccines with care. As an immunization provider, you are responsible for proper storage and handling from the time the vaccines arrive at your facility until the vaccine is administered. Why is storage and handling of vaccines so crucial? Because it's the only way you can ensure that the vaccine you are providing is safe and effective. To the naked eye, a vial of viable vaccine looks no different from a vial of vaccine that has been compromised or improperly stored. In fact, let's take a little test. Here are 4 vials of vaccine. 1 has been stored properly and is viable. 1 vial has been left out at room temperature, 1 has been frozen, and 1 vial has been exposed to light. Which one would you give your patient? That's right, you don't know, because you can't tell the difference. Heat, freezing, and light can be destructive. What happens to an ice cube when it's left out of the freezer is pretty obvious. Unfortunately, a vial of vaccine looks exactly the same before and after it has been frozen, left out at room temperature, or exposed to light. If you use the vaccine that is no longer viable, it would not protect your patient. Vaccines were developed to prevent dangerous infectious diseases, and improper storage and handling can ruin your vaccine. Do not take chances with your patients. In addition to the obvious health issues, you and your staff should be aware of the substantial costs of vaccines. They are very expensive. Consequently, improper storage and handling of your vaccine inventory wastes money. Everyone in your office should have a healthy respect for the value of your vaccine inventory. It is important you designate a person to be in charge of the storage and handling of vaccines, and a backup person. To give you an idea of how valuable your vaccine supply is, here are figures provided by the Centers for Disease Control and Prevention that point out just how much vaccine at a single immunization visit for 1 patient can cost your office. The vaccines needed for a single infant visit can cost $224 to $300 or more. For a toddler, vaccines cost from $128 to $198 or more per visit. For the vaccines a child needs before entering school, the vaccines cost between $125 and $194 or more. And for an adolescent, the cost of the vaccines jumps to $244 to $286 or more per visit. There is a lot of money invested in the vaccines you keep in your refrigerator. Posting a reminder on the refrigerator used to store your vaccines will help your staff remember that vaccines are expensive. How do you control the cost and maintain the integrity of your vaccine inventory? Make sure that all staff who handle vaccines, as well as other people using your refrigerator, adhere to very specific rules concerning storage and handling of vaccines. In fact, there are 7 basic rules that should be followed closely. We're going to walk you through each one in detail. But before we do, let's take a quick preview of the topics. Rule number 1. Keep your refrigerator and freezer within the proper temperatures. Rule number 2. Keep your vaccine within the proper temperature range. Rule number 3. Keep MMR, HPV, meningococcal, and rotavirus vaccines cold and protected from light. Rule number 4. Keep varicella-containing vaccines frozen and protected from light. Rule number 5. Follow best practices when preparing vaccines. Rule number 6. Rotate your stock. And finally, rule number 7. Transport your vaccines safely. By following these basic rules, you can save your practice money. But more important, you can be confident that the vaccines you administer are truly protecting the patients entrusted to your care.